Let's set up the AccuDrain cerebrospinal fluid collection chamber for your patient with an EVD. You can get all your material first. Then we're going to set it up on the pole. We're going to prime it, level it, zero it, and put it to the order per the neurosurgeon. The materials you're going to need is you're going to need your own designated pole. Get your AccuDrain collection chamber system. That's per your order or per your neurosurgeon. Get your transducer. This is specifically for our patients on the AccuDrain. This one does not have the pigtail like an art line has. You're gonna get a 3-way stopcock, and you're also going to get a flush that's a sterile flush. Getting set up, I like to have like a clean surface that I'm going to wipe down with. Typically, I like to do our purple wipes, and then I like to make a sterile field. I also like to wipe down the pole and any of the surfaces that I'm going to use when I'm setting this up. After the patient's prepped and ready to go, neurosurgery should be doing their thing with the patient. They're inserting the EVD into the patient. While they're doing that, you're going to get set up. We're going to set up a sterile field. I like to put down sterile towels, sterile gloves, and you're going to open up your packaging for your AccuDrain. When you open up your packaging, there's a little clip right there that's going to help you connect over to your pole. When you squeeze it, it's going to grasp onto the pole. So grasp on right there. This is the portion that's going to connect over to the patient's EVD. When we're done, I like to just hang this while I prime up while I prime all the tubing. You can grab your transducer. I have one that's already open. On my sterile field, I have everything dropped in there already. I also like to have typically another set of hands just in case I forget something. Let's just say I use all of my material and I need another one because I broke the sterile field. I like to get someone else in to help, to be able to hand me material so I don't have to break sterility. We're gonna imagine this is my sterile flush. I'm going to connect this to my transducer. And then I'm going to connect this to my 3-way stopcock. That way, when I'm trying to prime the system, I'm priming everything all at one time. So the 3-way stopcock, on the left side of the 3-way stopcock is where I'm going to connect my transducer. So now we have the flush, we have the transducer, then we have the 3-way stopcock. That's going to connect right next to this 3-way stopcock that we have for our AccuDrain. I'm going to open this up and I'm going to prime in every direction. I have no bubbles in there. When I connect over to my AccuDrain, I'm just going to place it on the side and tighten it up. Once that's tightened, I have a 3-way stopcock, and I like to imagine that the down direction is going towards the patient. So I want to prime towards the patient first. So I'm going to flip this 3-way stopcock off to what we call the collection chamber, the barrette. So it's open to the patient, and I'm going to flush that way. We are priming, and we have all the bubbles out. I like to use either like some sterile towels or like a bag or whatnot to collect this so that it's not slippery on the ground. But we are all primed towards the patient. From there, I want to go off towards the patient. And now that I'm off towards the patient, we're already primed towards the patient, which was down. Now we're going to prime all the way towards the collection chamber, the barrette. So off towards the patient is down. And we are going to prime all the way to the collection chamber. And now we're done. From there, I'm going to turn the 3-way stopcock that's connected to the transducer. I'm going to turn that off towards the syringe. and it's still clamped off towards the patient that way. From there, when I disconnect, I'm going to put my red cap on there. And we are primed and ready to go to connect up to the patient. So when neurosurgery is ready and they're done inserting the EVD, they're in their sterile field and they're going to hold this in right here. You're going to be sterile on your side, holding yours right here. And then when they're ready, they're going to connect and twist. Very similar to the same movement for when we're getting set up with the art line for our patients. However, we're never flushing back towards the patient the way we do for an art line. All right, so as of right now, we're clamped off to the patient. I want to level this first to our patient, and we're going to level it to the tragus of the ear. Inside your packaging for your AccuDrain, you have a leveler. Depending on what type of system you have, they all look a little bit different. But for this particular one, the leveler is green and it has the bubble with the two lines. And your goal is to get that bubble in between the two lines, lining up with the tragus of the ear of the patient. I'm going to take this string and we'll go all the way to the tragus of the ear of the patient. I like to already have the patient already in the position ordered by the physician. Say neurosurgery says they want them at 20 degrees, 30 degrees, whatever. We're going to put that patient at that order. Let's say for this one, 30 degrees for the head of bed. And we're going to lock the bed and put a sign on the door so no one comes in and makes the head of bed of the patient go up and down. That could change the level of the patient and they start dumping cerebral spinal fluid a lot faster. Just going to keep this tight. We're going to go straight to the tragus of the patient. We already see that we're too high up. So I'm going to grab this clip right here. And while I take one hand to the tragus of the ear, I'm going to go up or down for this particular reason. For this patient, I'm going to go down until I am level with the patient. The way you know you're level with the patient is when those two bubbles, when those two lines have the bubble right in between. So I'm not there yet. I'm going down. I'm almost there. And I'm currently level with the patient. The bubble is in between the two lines. There's a little hanger right there where I like to hang this. Because if you ever turn your patient, go down to CT or anything like that, you need to re-level this to the tragus of the ear each time. So now that we're primed, we're level with the patient, we need to zero this patient. It's still off to the patient on the three-way stopcock. It's pointed down off to the patient for the three-way stopcock, and I'm going to take this. I'm going to pinch this clip right here all the way down, and we're going to take this red line all the way to the zero right here. Now make sure you are clipped off to the patient first. I want you to remember that down means kind of like dumping. If you're going down, like if this falls on the floor, if you bring this barrette lower than the tragus of the ear, your patient could start dumping cerebral spinal fluid really fast, which could ultimately collapse a ventricle. When we're clamped off to the patient, down is off to the patient, you're fine. You're able to bring this red down to go zero it. So I'm pinching right here. I'm bringing this red all the way down to the zero right here. All right. From there, we're at zero right here. If we were connected up to the monitor, we'll connect up to the same ones that's for our art lines. And then on the monitor, you want to make sure that it says that it says ICP in there for intracranial pressure. If not, there's a drop-down menu. Just switch it to intracranial pressure. And just like you would an art line, you're going to press 0. So first connect this to your monitor. We're still clipped off to the patient. On that middle three-way stopcock, we're going to go off to the AccuDrain, and we're going to open this up to atmospheric pressure. So now imagine that the transducer is zeroing down to atmospheric pressure. We're going to press 0. It's going to say zeroing with an ing at the end. Then it's going to say zeroed with an ed. After it says zeroed, we're going to reconnect that cap, and we're going to open up that middle three-way stopcock. From here, we want to go to the physician's orders. If neurosurgery says to put it to, we're going to go to 8 centimeters of water. You want to very much differentiate the 8 centimeters of water rather than 6, 7, 8, the 8 millimeters of mercury. 8 of water is down here, where 8 millimeters of mercury is right here. So make sure you differentiate centimeters of water versus millimeters of mercury. Validate and verify that order is correct. Once we go to 8 centimeters of water per your neurosurgeon's order, you're going to open this three-way stopcock up for it to drain. Remember, down is towards the patient. So we're clipped off to the patient. We're going to point to the left. Left means you are draining. The next position I want to talk about in this three-way stopcock is up. When this is up, you're getting your intracranial pressure on the monitor. You're looking for your waveform, and you're typically looking for a number below 20. If you see greater than 20 sustained, you want to call neurosurgery. So far, we have we brought out all of our materials. We primed the lines. We zeroed it. We leveled it. And now we're ready to just start draining with our patient. But before we leave the room and walk out and do our other tasks, we want to make sure we secure this device. Right now, we're only clipped right here. Once we've leveled out to the tragus of the ear, we have a securing device right here, where you can just throw it over one side of your pole and cinch it down. That way, if you make a mistake and this hits something and your AccuDrain collection chamber falls down, it won't fall down to the ground. Because remember, if this system goes below the tragus of the ear without being clamped off to the patient, you could start dumping fluid really fast. Remember, down for dump. So after you've originally clipped it, you've leveled it to the tragus of the ear, secure the device by cinching one side down on your pole. There's also another way you can do it. I'm going to start over. So say you just have this and you need to secure it. Instead of going over just one side, we can throw it on both sides at the same time. And then from there, cinch it down. That way, it remains level to the patient even if this falls over. If it falls off, you're still going to be level to the patient. There's another securing device on there as well, too. Not only are you clipped with the button on the side, and you have this rope to cinch it down to this harness, there's also 2 rubber pieces on these blue pieces where you can connect over and cinch it down as well, too. That way you have 3 different ways that you're securing your device to make sure it does not fall on the floor to start dumping cerebrospinal fluid. So we've primed, leveled, zeroed. Now we've gone to the order of 8 centimeters of water per neurosurgery. We've locked the head of bed up. That way no one can come in and raise the whole bed or lower the bed. Because if you raise the bed, you're not going to be having cerebrospinal fluid come out accurately. If they lower the bed, you're going to be coming below the AccuDrain system and you can be dumping too fast. So your bed's locked and you have a sign at the door to remind everybody to check with the nurse first before coming in out of the room. Now, after you have everything set up, you've secured the device, you've primed, leveled, zeroed the patient, you want to know the 3 different positions for this 3-way stopcock that we have on the AccuDrain. Remember, we're to the level ordered by the neurosurgeon for the patient. It's at the tragus of the ear. We're at 8 centimeters of water. So when we go towards the transducer, when we're pointing over towards the transducer to the left, we're draining. It is draining cerebral spinal fluid into the collection chamber. 99% of the time, you're going to be draining your patient. It's always going to be pointed to that left. Now, point it down. If you're pointed down, you're clamping off the patient. I recommend clamping the patient for if you have to travel, go to CT MRI, if you need to turn the patient, if respiratory therapy comes in and they need to do inline suction with your patient, and they're going to do that big cough. Anytime they suction, you want to clamp your patient off. Go off to the patient when you're zeroing, and then when you're traveling, so when you're traveling, zeroing, turning, or if you have to suction your patient. When in doubt, clamp that patient and call neurosurgery if you're having too much fluid coming out or too little fluid and you need to call neurosurgery. When in doubt, just clip it. Down is going to be off to the patient. That's what I'm calling clip or clamping it off. Remember, when we're pointed to the left, that's right. You're going to be draining the patient, going out of the ventricles into the collection chamber. And that last position on the three-way stopcock is up. Every hour, at the top of the hour, you want to get intracranial pressure, your ICP. Point this up, and then you're going to look on your monitor, and you're going to see what the intracranial pressure is. Once you see that waveform, go all the way across the screen, notate that number. You're going to chart that number. If it's greater than 20, and it's sustained, call neurosurgery and let them know that you have a intracranial pressure sustained greater than 20. After you get that intracranial pressure, we're going to look at this AccuDrain from the side. And for the whole hour, you've been collecting cerebral spinal fluid. Let's just say you've gotten 15 this past hour. After you've checked your intracranial pressure, you've done your neuro checks, your pupil assessments on your patient, you're just going to drain what's in this collection chamber into the bag. So we're just going to turn it away from the barrette so it goes down like it just did and go right back up. Don't forget to turn that back off towards the barrette so it can collect for the next hour. You want to notate how much cerebral spinal fluid has come out in the last hour, and you want to say what it looked like. Originally, it may be more of that bloody color. As time goes on, it's going to get clearer and clearer. However, as time's gone on, it's gone clearer, then all of a sudden it's gone to bright red blood. You want to clamp it and call neurosurgery and see if there's any other further directions that they want you to do. Remember, we talked about 20 of your intracranial pressure when you're checking it. If it's sustained, call neurosurgery. But also, in your collection chamber, if you've gotten more than 20 cerebral spinal fluid for that hour, you want to call neurosurgery as well too. So just kind of remember what perfect vision is. It's 20/20 vision. If you remember 20/20, greater than 20 on the cerebral spinal fluid, sustain 20 or higher on your intracranial pressure for you to call neurosurgery. Let's review those three positions on your three-way stopcock. When you're pointed left, this is where you're going to be majority of the time. You're going to be draining your patient. When you're pointed up, you're getting intracranial pressure. This is what you're doing at the top of the hour every hour. And that last position is pointed down. You're clamping off to the patient, turning, suctioning, traveling, and zeroing. Once you're done there, make sure you're at the back of that order, centimeters of water versus millimeters of mercury per neurosurgery, and go back to draining.